Hi, so I am Ange. I'm a urology doctor in Glasgow. So, in terms of social constructivism, I would say we do apply this quite a lot in our practice. And I suppose an example of it would be being a supervisor or a facilitator of a group of medical students or a group of young trainees performing an audit project. So, finding an audit project needs to be quite interesting so that the trainees or the learners are motivated to perform the project and hopefully promote a wee bit of intrinsic reward. As clinicians, it's pretty much compulsory for us to do some sort of audit work to kind of promote clinical governance and quality improvement within the healthcare. And performing audits also offers the opportunity of presenting it in international conferences or offers the opportunity of publications and stuff, which does add points to a CV. So there is an element of extrinsic reward there. So an audit cycle usually involves creating aims and objectives, finding a method of collecting all this data, analysing the data, and presenting the results in a form of a poster or a oral presentation. And throughout this process, as a facilitator, I would encourage the learners to come together and discuss ways of approaching this project and how to find the aims and how to collect the data. And if there are any points in which they are struggling, then as a facilitator, I would offer them some guidance. So that would be an example of some scaffolding. And as they are managing more on their own, I just have more of an observation role to ensure that the progress, to ensure that the audit is progressing well, essentially. Throughout the whole steps of performing an audit between a group of students or trainees, I'm sure there is often a experience of transition from a zone of proximal development to a level of actual development. So an example would be one of the learners are struggling to obtain the skills to find papers for a literature review, for example, and perhaps one of the peers or maybe myself has a slightly more senior skills or more advanced skills, in which case we would act as a more senior mentor or a senior peer to help transition that peer or colleague from a zone of proximal development to level of actual development so that they can obtain a new skill or a new piece of knowledge. And that can be demonstrated in any part of the audit. So I would say that from a social constructive point of view, an audit would probably be an example of an inquiry-based learning. Another thing that I do quite a lot is clinical bedside teaching, and I try and incorporate a wee bit of case-based learning as well, which is something that the Glasgow medical students are quite familiar with. The only difference that I do is try and incorporate a wee bit of patient interaction. So what I tend to do is get a group of maybe 3 to 4 medical students, and I would allocate them a patient with obvious patient consent to take a history from them, look through their notes and analyse their investigations. I would give the medical students questions in advance for them to answer, and then once they obtain that information and kind of read and studied, they come back and we sit as a discussion group and go through the case in greater detail to kind of fill in gaps in their knowledge and also clarify particular things like, findings on a particular scan or interpretation of blood results. And often that's had pretty good feedback because it gives them a really realistic idea of what a doctor is like in terms of seeing a patient at hand, going through the examination, investigations, treatment and the outcome. So it's a really nice progression of a patient journey, and often that's quite valuable for medical students.